as a 99214. Yes? Okay, could we put in the diagnosis weight loss? You bet we could. Because ADD doesn't necessarily mean weight loss. Now, if you have somebody who has scarlet fever, you don't also get to put fever and strep throat and pharyngitis. That's called unbundling a diagnosis, okay? But if they have ADD, that doesn't necessarily mean they also have weight loss. So you can put ADD as number 1 or weight loss as number 1, either way. So yes, that still gets 2, but it still doesn't get us up high enough to change anything. Okay, but yes, weight loss is very appropriate to put in your diagnoses right there. Let's go to KD07.
The medicine used to be helping a lot, but I don't think it's helping very much anymore.
So Katie here has a chronic problem with what? Okay. The medicine is not helping much anymore. What does that mean? That means I'm having more symptoms. So this is technically exacerbation. Okay? Semantics doesn't really matter. Would you say this is mild, moderate, or severe? Mild or moderate. It doesn't matter. It's not severe. I mean, unless we have more, that's not severe. So whether it's progression or exacerbation, it doesn't matter either. It's still mild. So I would call this a mild exacerbation. She's having less control of symptoms of a chronic problem. So I would say this is a level 4 patient. You can look, this is a 2-second history. In 2 seconds, she has conveyed to me, I have a level 4 problem. Why don't you please write it down and bill me for it? No, that's not what she said. But that's what she said, okay? Because I've learned to listen. Our longest clip in here today is going to be about 6 seconds. Okay, Ben talking about the rock in his nose is the longest one. That's at 6 seconds. 5 seconds is what it takes most of the time to figure out if this is level 3, 4, or 5 patient. Because they tell us very quick. If they don't tell us right away, our first question will usually get it figured out for us. So, she has a 99214 problem. Does she have a 99214 note? So, we are on page 38, right? All right, okay. Does she have at least 3 diagnosis or treatment plans? Okay, she does. Does she have physical exam of at least 2 organ systems? So I don't even care about history still. And remember what I told you earlier, if you examine the patient, then rarely is history going to come into it. This is what I mean by that. Because if I had not touched this patient, and I'll tell you, sometimes on ADD people that are absolutely stable, I might not touch them. Their blood pressure's fine, their weight's fine, their heights, everything's fine. I've seen them for 7 years, and they've been on the same dose for 5 years, and they come in every 4 months, and they're still fine. And I just did a sports physical on them last month, and I may not even touch them. Sometimes we have patients we don't touch. That's okay. So if I didn't touch them, I would need at least 4 elements of HPI, which I don't have. I'd need at least 2 elements of review systems, which I don't have, and at least 1 area of past family social history. And you can make a case for, well, she's on this much medicine. But I need a lot more history. But since I touched her and had a little bit of physical exam, I'm covered. I'm covered. So, as it's written, is it a level 4 note? Yes it is. Let's go to KD09.
Ever since I started that new medicine, I feel like a zombie. I'm just out of it. I don't know. I'm not myself.
Let's see. Here's what we wrote after talking to her. Patient here for follow-up of ADD. Since changing medicine at last visit, and notice that she is, quote, like a zombie, out of it, and not like herself. Mother states that she is very withdrawn and will not do any of her normal activities or associate with her friends. This is a chronic problem with severe side effects. More than likely, it's her medicine causing her to do that. Because an ADD kid does not get withdrawn. And they're not in a hole somewhere if they're exacerbating. They're all over the place. So if she's having this, she's having severe side effects. So we're saying this is a 99215. Let's look and see. What do we need for a 99215? We need at least 4 diagnosis or treatment plans. Do we have that? Are you sure? Okay, yes, we're sure. Strong work. We do have 4 treatment plans, and those are all treatment plans. Do we have a physical exam of at least 8 organ systems? No, that's 7. No, it's 8. I made you count. Yes, we do. So, even though we don't have this big, huge history, that is enough note for level 5 patient. Okay. So let me ask you this. When do side effects progress from moderate side effects to severe side effects. Now we know, like for example, let's take the case of, whatever. Let's like diabetes, insulin. We give somebody too much insulin, they went, and their blood sugar was 10. Yeah, that's a severe side effect. We know that. ADD, depression, anxiety, psych stuff. When does that become severe? At what level?
Interfering with functioning.
Okay, we can say interfering with functioning. Here's what I would tell you. At the level that I put severe in my history, if I see a patient and I think this is severe, whatever, severe respiratory distress or severe side effects of medicine, when I write my note, I can put patient is here for follow-up of ADD, now having severe side effects. I'm going to help my auditor out and use the word severe and then explain what I mean by that. Okay, now if I say she's having severe side effects, she's lost a whole pound, and that's not severe side effects. I'm going to explain what I mean by severe side effects. So if I'm going to put severe in a subjective way, I need to put the word severe and explain why. And so if I'm going to bill a level 5 patient that has a chronic problem with either severe exacerbation, progression, or side effects, I put that in my second line of my note. Patient's here for follow-up of this, now having severe exacerbation with these symptoms, and explain it. I use the words. That's how I help the auditor know if I think it's severe. Now, sometimes it is severe. If their blood pressure is 220 over 180, that's severe. There's objective ways of saying that. If their peak flows are 20%, that's severe. But in a subjective world, with a lot of our subjective diagnoses, use the word mild, moderate, severe, and that's going to help you focus your note and focus your coding. So, now we're going to go to Teresa 01. Now, Teresa, we're going to get back to writing notes. We're going to be writing our notes. Yes? Yes?
What was the relevance of checking, like, say, for instance, the musculoskeletal
Okay. And Katie came in with these problems. What was the relevance of making a big exam? Okay, I think the essence of the question is, why did you examine all this stuff? The reason I would is because if I have somebody that's coming in and having severe this, whatever severe is, I think it's probably from the medicine. But what if it is something else? You know, and so I want to do sort of a good head-to-toe comprehensive exam. And so now, should I have done the big physical? Should I have done the big history? Well, maybe. Maybe I should have done a big review of systems and figured that out. Maybe I should have done a complete past family social medical history to figure that out. But if she comes in with these symptoms, just like let's take a diabetic that passed out last night, probably it was because he got too much insulin. But what if you start doing all this stuff and you find out on your musculoskeletal exam that now he's so weak he can't stand on one foot? Or he's now hyperreflexic, super hyperreflexic. You think, oh, maybe something's going on in his head, may not be endocrine. And so part of the requirements for a level 5 patient, we're saying this is a high-risk patient. And usually when we say that's a high-risk patient, it's going to require more history and physical to see what's going on. And you look, this is musculoskeletal exam in a kid this age. Doesn't have to be all their strengths and weaknesses, and it's basically they're moving their all extremities and they're normal and these kind of things. Now, what if I didn't do a musculoskeletal exam? Well, then I didn't do a musculoskeletal exam. What if I didn't get 8 organ systems in exam? Well, I still have a level 5 patient. I better have had enough history to fulfill the requirements. And if I didn't, then my note may be knocked down to a 4 or a 3 if I don't have enough note writing stuff there. Because when it comes down to it, it would be so nice if the government said, this is what a level 3, 4, 5 patient is, and we're going to trust you to do the appropriate amount of stuff. History, physical exam, decision making, we're just going to trust you, do what's necessary. But they don't. They say you better have 8 systems. And so if I know this is a level 5 patient, I'm going to examine 8 systems because that's what they're saying is required. So is that the best way to do it? Is that the perfect way? Probably not, but I'm going to make sure that I fulfill their requirements to bill appropriately. Now, should I have downcoded this to a level 4? No, this is a level 5 problem. It's a level 5 problem. Okay, I don't know if that answers your question, sorry. So, all right, let's go on to Teresa, and here's the difference. Let's see what Teresa says.
My nose has been running.
Okay, my nose has been running. Here's the difference. We're not going to grade Teresa's notes. We're going to write Teresa's notes. We've had plenty of experience here looking at histories and physical exams and decision making. Now we're going to get to the nitty-gritty of writing some notes. And go ahead and like I said before, if you're going to do a review of systems, check off which systems you would review. If you're going to do the physical exam, just put a check mark by that physical exam. You're saying, I would have looked in her eyes and ears and nose and throat. I would have listened to her heart. Just check it off. If you would do the medical history, the family history, the social history, write your notes in there. If you get more history from this patient, HPI, write your notes in there. Get your diagnoses, get your treatment plans. And we have a 4-minute song to write your note, and then your time is up. All right, let's grade our notes. Teresa 01, patient's here for complaints of a runny nose. This is how you can tell the adult examples were made up by the pediatrician. So, her nose has been running, is why she's here. What should be the level of service? Probably a 3. Probably a 3. How many said a 4? All right, why was she a 4? Because what? Okay, we said somebody gave her prescription drugs, made her a 4. The internist. And she has COPD, and she has, okay. That's fine. That's like, you're writing this note. I've got no problem with that. As long as we use our words. Now, does anybody say she's a 5? Okay, whew. All right. So, those of you that said she was a 3, okay, let's talk about what are our diagnoses. Number 1? Somebody said allergic rhinitis. What else? Anybody else? Upper respiratory infection. Rhinorrhea. Okay. Treatment plans. What kind of things did we have? Antihistamines, fluids, over-the-counter meds, follow patient instructions. Okay, let's start. If we're talking about a level 3 note, on a level 3 note, did we put at least 2 diagnoses or treatment plans? Surely you did. Okay, if we don't learn anything else, you better learn about diagnoses and treatment plans today. How many of you examined at least 2 body areas or organ systems? Hopefully most of us did. How many put anything in review of systems? Okay, wow, a lot of you, good, okay. How many put anything in medical history? Good. Family history. See, I love to lose a checkbox. I put non-contributory, non-contributory. Now, yeah, I got credit now. As long as you ask it, you do get credit. So, very, very easy to get a level 3. We need at least 2 diagnosis or treatment plans and at least a couple organ systems examined. Now, for level 4, we need at least 3 diagnosis or treatment plans, and it's the same thing on history and physical, basically, or physical. But remember, it's not the note that makes it a level 4. It's the patient. And so we had one back here that said, yes, I put her on a prescription drug, and that makes her a moderate level of risk. So I made her level 4. Does anybody else here say it was uncertain prognosis? Probably not. How about, did anybody here give her acute illness with systemic symptoms? See, that's a good one. You should write at the end, put runny nose and fever, level 4. Okay. Okay, let's bring up this question. What about the patient that says, I've had fever, or my kid has had fever, and today in the clinic they are 97.5. So, is that systemic symptoms? What if they didn't take it right? I don't want to know, okay? Because we have 3 things here. We have medical decision making, we have history, and we have physical. If somebody says, I've had fever for the last 4 days, 204, that is history. If the nurse says they have fever of 104, that is physical exam. Systemic symptoms doesn't have to be history and exam. It can be one or the other, you know? I mean, let's talk about vomiting. I would much rather have vomiting by history than by exam, okay? I don't want vomiting by exam. I trust you, okay? You don't have to have both. And so, well, what if they're unreliable? Why did the mom bring your kid in? Because it had fever, okay? Fever, fever, fever. And how high was it? Well, it was, I love this. I don't ever ask how high it was. I say, did you get a chance to take it with a thermometer? Because otherwise, we'll say, how high was it? Well, it was 103.7. How'd you take it? Well, Well, I know that normally they're 102, so so I don't ever want to pin them on that because it just sort of makes everybody uncomfortable. So, did you get a chance to take up the thermometer? And if they say no, that means they never had a fever, right? No, you can still have a fever if you don't take it with a thermometer. Okay, so we're not going to be real punitive on what we do. So, very easy note, very easy patient. Let's go on to Teresa O2. Yes. What about a person says, I'm feeling tired, I have a runny nose, and I'm just really tired and weak, and I can't get out of bed hardly. I'm just exhausted all the time. Probably systemic symptoms, okay? Probably systemic symptoms. Now, if you know that they've always been that way their whole life, that may be normal symptoms. It may not be systemic. But yeah, that's going to push them up to that level 4 area because that's going to take a little bit more work than somebody just has a cold, right? I mean, so we've got to do more stuff about it. One other question? Yes. Okay, yeah, it says there's no place here to put vital signs. That is because, in my example, I didn't really put vitals. So you can put it as constitutional. That's what Medicare considers vitals, is part of constitutional. Now, obviously, heart rate is part of cardiovascular. Respiratory rate is part of respiratory. Temperature is part of constitutional, as is weight, as is height. Those are considered constitutional findings in the physical exam. What do? We put vitals right before a physical exam. Why? Because that's the way we did it yesterday. That's what we do. But actually, vital signs are considered part of your physical exam for constitutional, cardiovascular, and respiratory systems. Blood pressure is a part of the cardiovascular physical exam, is the blood pressure. So that's where those fall into there. But you can put them wherever you want. I don't care. Yes? Good question. Can I put supportive care in there? And in my mind, supportive care means encourage fluids. Come back if you're not better tomorrow. Take Tylenol or Motrin if you're not feeling good. That's what I mean by supportive care. If you put supportive care in your treatment plan, you get credit for what you put. You get credit for one thing, supportive care. Same thing. Let's say if I give somebody an influenza handout and it says 17 things on there, I don't get credit for 17 things. I get credit for giving them a handout. Now, what I'll do a lot of times, like for example with influenza, I'll say all those things. Discussed, when to come back, number one. I told them if they get worse to come back here and, watch for this, do this, do this. And like for example, if I have a common level 4 problem, like let's say if it's influenza or croup or something like that, and I have a sheet that I give them, I make sure in my treatment plans, I've got my 3 things I'm going to put in there no matter what, because when I get audited, not if I get audited, when I get audited, again, I want to make sure it's in there. And so I make sure there's 3. I don't want to have to explain what supportive care means. I want them to look, see, 1, 2, 3, check, go to the next one. That's what I want. I want to help my auditor every way I can so that there's nothing I have to explain. It's all right there. So, Teresa O2.
I've tried that and it's just not helping.
Okay. Patients here for complaints of allergic rhinitis, not responding to over-the-counter medicines. Write your note. Go. You have 1.5 minutes. So, we're going to get a lot of practice writing notes. Time to blaze through there. And before you write your note, I want you to think. This should be a level 3, 4, 5 patient. Therefore, I will write a note to meet the requirements of a 3, 4, 5 note. Go. 30 more seconds. Hurry up, doctor. There's patients waiting. You're behind. Write your note. Quicker. Come on. Nobody has nurses like that work for them, do they? Just me. Okay, so in all of these notes that we're going to write, here's what I want your thought processes to be. And I'm actually change the template a little bit next year. What level of service should Teresa be in this particular instance? Anybody? 4. Okay. Anybody say other than a 4? Okay, anybody? Why? Okay, he says a 3 because it's uncomplicated. Well, let's start going through here, and that's fine. This is you are writing your own note. I'm not going to disagree with anybody on this. Somebody may have said, well, she's a 5, and here's why. I just like to hear why, and I might disagree with that. But it's level 4, and so why did all you 4s say she was a 4? Okay, so we said a chronic problem with mild exacerbation. I would agree with that. Okay. Could you make a case for mild progression of disease? Not being controlled with our tier 1 medicines? Sure we could. Would you say she's having mild side effects? No. Does she have 2 stable chronic problems? No. And this is okay, so I agree with that. So let's look. So, level 4, 99214. Did you put at least 3 diagnoses? Anybody put 3 diagnoses? Okay, kind of allergic rhinitis, kind of what we got. Did anybody put 3 treatment plans? Yes. How many did anybody put more than 3 treatment plans? Okay, so that makes it a level 5, right? No. The note doesn't make it anything. We have to remember that. The patient makes it a 3, 4, or 5. So we have at least 3 diagnoses of treatment plans. What are some of our treatment plans? Who here did not prescribe a drug? Yeah, I know. You guys have to write those drugs, right? We have to. Of course we tried. We tried Benadryl. It didn't work. Okay, so we wrote a prescription. We had a medicine. That's treatment plan number 1. What else treatment plans?
Get rid of the cat.
Get rid of the cat. Okay, now I got to tell you, I had this patient call yesterday. No, it was Tuesday. Mom called. It was very, very poor family, because it always is. All the kids are having trouble with flea bites. And we've had the house sprayed. We set off the little flea bombs that we got from Walmart. We did that 3 times over 3 weeks. It didn't work. We've had an exterminator come in here twice to spray for fleas. It didn't work. What medicine can you give me to get rid of these fleas? And I said, get rid of the dog. And she was pissed. Okay? They don't want to hear get rid of the dog. They don't want to hear it. That's the only thing I know. How else do you get rid of fleas? You got to get rid of the animals. So I don't know why I went on that tangent, but I just thought it was kind of amusing that the one treatment that would have worked, they don't want any part of. They want a medicine to fix it. So what else? We get rid of the cat. We did a prescription drug. What other things get our 3 treatment plans? Avoidance. Continue the over-the-counter medicine. Sure. Follow-up. I put follow-up on every single note because that just makes me one step closer, and I do it anyways. From a business point of view, I always tell people when I want them back. Yes? How would we say follow-up if you're not better? You bet. That's a patient instruction. Yes? Okay. I think that's very good because that is patient therapies or instructions. And a lot of times, like for example, there's 4 of us in my clinic. There's 2 nurse practitioners, 1 PA, and me. We all see all the patients. And that's what I put in mine. I put in there, we're going to start them on Nasonex, I don't care, whatever. We're going to start them on Nasonex, and if that doesn't work, then I immediately want to go to this and not this, because in their family, they've had good success with this before. A lot of times I'll put that in there so that when the next person that sees them, whether it's me or somebody else, knows that kind of thinking, they just seem a lot smarter, even if it's me, because I usually don't remember from time to time. And so, yes, that's still a therapy or an instruction. Okay, what about mild sore throat? Lucky for you, that's going to happen within a couple pages. So we'll talk about it then. Okay, so let's go on to Teresa 03. I think we're pretty comfortable with writing that note.
The medicine makes me really sleepy.
Okay, now that you're experts on this, you've got 1 minute. No more 90 seconds for you guys. Crank out a note. Well, let's start here. Is this a 99213, 4, or 5? 4. It's a 4. She's having mild side effects. So write you a level 4 note. You have 1 minute. And this is a very common exercise. When you get back to work on Monday, all day long you're going to be thinking, okay, I got to write a level 4 note. And we're going to have a lot of them. Because you need to get in the habit of knowing exactly what you've got to put in a level 4 note. So we've got to know this inside and out. Let me ask a show of hands here. How many of you, writing this note, went and skipped over history and physical and went down to diagnosis treatment plans first? Anybody? Okay. I agree. I talked with a guy last month when we were at a conference, and he said, why don't you just rearrange this and put the diagnosis treatment plans at the top, and then we'll fill in the history and physical later, because you obviously think that diagnosis and treatment plans are more important, and I do. I do think that. And we actually did that. We rearranged the template, and it's just difficult because we didn't do it that way yesterday. I still go along with that. The main reason we do anything today is because we did it yesterday, and we know subjective, objective assessment and plan, and we can't put objective up top. We can't put an assessment plan up top. It's just too hard for us. So it's fine to go down to the bottom and fill that out first and then finish up. So we said she has mild side effects, a 99214. Do we have at least 3 diagnoses? What diagnosis do we have? Number 1, allergic rhinitis. Okay, fatigue. We can put that as a diagnosis. Sure. Do we have at least 3 treatment plans? Treatment plans are what? Change the medicine. Maybe restart another medicine. What else is treatment plans? Get rid of the cat. Okay. What else? Follow up. Okay. Anything else? A diary of symptoms. I love keep a diary of symptoms because that just lets me, especially headaches. Oh gosh, don't have headaches. Keep a headache diary for 3 months and come back now. Okay. Do we have at least 2 areas of physical exam? How many of you did 4 or 5? Yeah, we have to. We have to do that much. We just like to do that much. So you've now written another successful 99214. Let's go to the next one. Here's the thing, on page 43. Page 43. We're going to grade each other's notes, so you better make it a good one. Teresa, 04. What does she say?
I've had a sore throat.
Okay. Now, Teresa's here for complaints of new onset sore throat. She has stable chronic allergies, well controlled on her current medication, 1 medication. So, in our minds, right now, you got to think, is this level 3, 4, 5? Write the note. I'm going to give you 2 minutes now, since it's a little bit harder. And in 2 minutes, at 12:02, we're going to pass our notes and grade it. You're about to get your first audit since all your coding instruction. Trade papers to your left this time. Now remember, when you get audited, most auditors are not going to look and see if this should be a 3 or a 4 or a 5. Now, good auditors will, but they're not. They're going to look at the note. So let's look at the note. Let's look at the note. And I want you to audit this. You've got your cheat sheet right here. You look at the cheat sheet, auditor, and you tell us if this is a 99213, 3, 4, or 5. And you as the auditor, since you're not getting paid, you need to get done in about 20 seconds. Okay, auditors, get your evaluation back to them now. Trade your papers back and let's look and see what we've got to work with. Let's have a show of hands. How many of our notes here, okay, when we got our notes graded, how many of our audits said that this should have been a 99215? All right, nobody. How many said it? Yeah, your auditor's never going to say, oh, this should have been a 5, but it's only a 3. Here's your money. No. Okay, how many said it should have been a 4, and it is a 4? How many said it is a 4? How many said it is a 3? How many said it's a 2? Okay, good. So we're all in the 3, 4 range. Okay, another show of hands. How many here think it should have been, on your own notes, how many think you should have had a 3? How many think you should have had a 4? Aha! So, we have a nice little dichotomy here. Is this a 3 or a 4? Aha! She has a stable chronic problem, which is a 3. And she has an acute uncomplicated illness, which is a 3. So, she is a 6. No, she's not a 6. Okay? You don't get to add them together. So, what does this mean? So, here's what I would tell you. Anybody have any ideas how we reconcile this with our words? Okay, what does she have? Okay, low risk. Why? We have stable chronic. We have an acute uncomplicated. Those of you that think this should be a 4, why? Okay. If she had systemic symptoms, that would make her a 4. But let's say she has just this. All right, here's what we're going to go back to. She has an acute illness complicated by a chronic problem and chronic medication. That's what she has. Because she has sore throat. Why does she have sore throat? Could be an infection. It could be a side effect of her medicine. It could be an exacerbation because her medicine's not good enough because she's having more drainage at night with her allergic rhinitis. It could be whatever. If you're seeing this patient with a sore throat, does the fact that she has allergic rhinitis and is on an antihistamine factor into your decision making? I hope so. I hope so. Okay? And because how many times have you seen somebody like this and say, well, I think it's just because your allergies are not well enough controlled, let's do this. Or I think it's your antihistamine that's making your throat dry and that's why you're having a sore throat. Or it's maybe strep, who knows? So, when you have a chronic problem and an acute problem, almost all the time, that elevates you to an acute, complicated problem. Because as opposed to the person who just has a sore throat, this person has a sore throat with a chronic problem and chronic medication that we have to take into account. That's what differentiates from a 3 to a 4. So, now it doesn't mean that 2 lows make a moderate. That's not what I said. Because that's a very common misconception. This lady I was working with a month ago, she said, well, it had a couple lows, and so that makes it up to a moderate. And I said, no. She said, yes, it does. And I said, show me. Bill, because it's harder than, and now we don't get to use harder. So, she has a moderate, because she has an acute complicated illness. So, let's go on to the next one, Teresa 05. Page 44. What does Teresa 05 have to say?
My throat is killing me.
Okay, here's what I want to see. My throat is killing me. It says on there, make it a level 4. Here's what we're going to do. I want you to make it a 5. In what context would Teresa's sore throat ever get her to a level 5? Because it could happen. Okay. No, don't tell me. Write it down. Write your level 5 Teresa note. Okay, since it's a 5, I'll give you 2.5 minutes. And you can use your colleagues at the table if you need help. That's fine. We do that all the time at my office. I think this is level 4, but I just can't come up with any other treatment plans. Well, I'll say, well, did you tell them this? Oh, yeah, I did. Put that in your note. Use your colleagues. Okay, now remember, we're kind of taking liberties here. I said make it a level 5. We don't get to make patients a level 5. But what could Teresa have had in history or physical that would make her high risk? Okay, let's talk about, right, first off, severe sore throat. How many here said she had a high risk chronic problem? Anybody? Yes, what'd you say?
She has diabetes, COPD, chronic allergy.
Okay, the internist. She has severe diabetes, COPD, in addition to chronic allergies. Sure, especially if she's got all these other problems. Who else said chronic problems made it a high risk? At the back. Okay, so we're going down to acute. So what in here? We could say threat to life or bodily function. What would make her life-threatening or bodily functioning threatening? Okay. Yeah, probably dehydration as a word, but we could say she's in hypovolemic shock. What if she is that dehydrated? Okay, sure. I've had to put kids in the hospital before for hypovolemic shock for a sore throat because they just flat out won't drink enough. What about anuric? A little bit of acute renal failure. So what about if we have abrupt change? Do we have abrupt change in neurologic status? No. So either you got to say it's a life or bodily functioning threatening area, or it's a severe chronic area. So to have a 99215, how many here have at least 4 diagnoses? Okay, good. And like I said, just put in your concurrent diagnoses. How many here have at least 4 treatment plans? Okay, now look at your treatment plans. I want you to look at there. If you have a lab or an x-ray or a diagnostic procedure in your treatment plan, put a line through it. Remember, those are data review. You don't get credit for that. So you might have just now gone below 4. That's a common thing that happens. So you have to have at least 4 diagnosis or treatment plans and physical exam of at least 8 organ systems or the big history. How many here did physical exam of at least 8 organ systems? Okay? Now, how many here did the big history? Okay, so some of you didn't raise your hand on either one. You don't have a level 5. So honestly grade yourself. Did we write a level 5 note, a 99215 note, now that we've taken out how much history, physical, and decision making? Okay? And I'm not going to ask you to show your hands, that's fine. But what you'll see is now that we are experts, we still miss stuff. Okay? I teach this class all the time. I still have days where I think, oh, I should have done this, or I should have written this, or I should have coded like this, and I forgot. I didn't do it. Let's go to Teresa 06.
I've took some Motrin, and it helped a little bit. It's still really sore.
Okay, complaints of sore throat, not responding well to Motrin. In our minds, we're thinking this is a 99214. Why? Okay, we can say progression, but usually progression is talking about a chronic problem. Okay, we can say exacerbation, okay, but basically we're talking about sore throat here. This is where it gets a little tricky. Sore throat, what do we have? Is it uncertain prognosis? Probably not. Are we having systemic symptoms? You could give her some. Are we having a complicated illness? Yeah. Okay. Here's another thing that can complicate an illness. If they are adhering to the recommended therapy and not improving, now they are getting more complicated. You've tried, again, like we talked about, tier 1, it doesn't matter if they're prescription or not. Treatment number 1 failed. That becomes more complicated. This is complicated by a lack of response to a normal treatment. Most sore throats do okay with ibuprofen. Some do not. So, we're going to have 60 seconds. We're going to write this note. Okay, so you're going to write a level 4 note again. A level 4 note. We're going to say you don't get to add any more HPI to it. Fill in your history that you do. Check off your physical exam. Do your diagnosis and treatment plans. 1 minute. Because you got to go to the next patient. And I'll tell you, that's really my goal. We're involved in making an EMR system, helping design one. And my goal with the EMR system is, in an average situation with an average patient, the doctor should be able to finish a note in 1 minute. If not, then there's too much crap going on. There's too much stuff going on. Because most of the time, you should be able to dictate it that fast. Now, if you literally can't even dictate it that fast because it's such a complicated, that's different. But if you can't get it out through your hand, either to the keyboard or to the pencil as fast as dictating, then we're losing time, we're losing money. We could have either seen more patients or got home earlier. Either one is fine with me. So, 40 seconds, get the note written. Okay, 99214. How many diagnoses? Some people said 2, some people said 1. What are our diagnoses? Some people said strep, some people said pharyngitis, tonsillitis. We have dehydration over here. Anything else? Okay. What are our treatment plans? Number 1, a prescription drug. Is it antibiotic or pain medicine? I don't care. Oh, so 2 prescription drugs. Okay, so there's 2 treatment plans. What else did we do? Fluids. Explain side of patient instructions. Follow up. Okay, so we have at least 3 diagnoses or treatment plans. Did we get at least 2 physical exam organ systems? Then again, I don't really care about the history. Let's go on to Teresa 07. And I'm not going to make you write this one because we've already had experience with this. In fact, we're just going to skip Teresa 07 because it's a level 5.
I haven't been able to drink.
It's the urine output one. Okay, Teresa 08.
Sore throat and fever for 2 days.
Okay, Teresa 08. Sore throat and fever for 2 days. This should be a level. I love these patients. What did she say? She said, I've had a sore throat and a 99214 for 2 days. She said, and fever. She said, I have had systemic symptoms, doctor. So that means 214. That's because they're sicker than the ones who haven't. So we've got plenty of experience writing a 214. Let's go on to number 9.
Well, I came in 2 days ago and the other doctor said I had strep throat and put me on some medicine, but I'm not feeling any better.
Okay. She came in 2 days ago, was started on medicine. May not be our medicine of choice, but another doctor put her on medicine. Put her on medicine, and now she's come back now 2 days later and she's not any better. Okay, what if I say, stay on this medicine. If you're not better in 2 more days, come back. That's a level? 3 or 2. Anybody else? 2, 2, 2, give me 3, give me 3, give me 3. Okay. Now this is a level 4. Why would it be a 4? Okay, let's say if prescription drug management means we change something. If I don't change anything, this is a 4. This is a complicated illness now. Okay? Because the couple things. Remember, we're on page 48. Okay? Let's say what happened. She was started on a medicine and she's not any better. Let's say if I don't make any changes, and I say, you haven't taken the medicine long enough yet, I still think you're going to get better. Okay, this is a complicated patient because she has this thing that is complicated by she's failing to improve. Okay, that's number 1. Let's say I talked to her and she says, well, he put me on Zithromax, and we saw him at 5 o'clock on Wednesday, and I didn't really get it filled till yesterday. So I took 1 dose last night, and today I'm not any better. Now we're complicated by non-compliance. That is a complicating factor. If you say do this and the patient does not do this, that's a complication. Okay? Now what if they should have been better by now because they took it on day 1, day 2, and they've already taken it again this morning, it's been 48 hours, and we think they should have been better. Now it's complicated by failure to respond to appropriate therapy. All of those make it a level 4. All of those make it a level 4.